Doctors of Reddit, what is the most unethical thing you have done, or you have heard of a fellow doctor doing involving a patient? From a patient perspective, I still have trouble with this one. I was getting a severe wound on my shin cleaned of debris with a scrub brush. The doctor for some reason wasn't wearing any face protection and managed to splash wound juice into her mouth. Her response was a PFFBTPLBBFTPBFFFTT. I got your juices in my mouth. I was horrified. Never returned. Edit. Poor diction. Close bracket. My roommate in dental school was a medical student. There was some big scandal at the hospital he was doing a rotation at because an anesthesiologist left the or with a nurse anesthetist and left the patient alone. Something went wrong and the patient passed away on the table. Where were the two of them? Getting down in a nearby unused room thinking that nothing could happen in just a few minutes. I briefly worked at the front desk clerk for an ER at a local hospital. The rule was anyone that came in complaining of chest pains had to be back and on a machine within 10 minutes of arrival. Once I entered their name into the system, a clock started. So I was told not to enter their name until they had already been taken back to essentially make our numbers look better and make it appear as though they were receiving care within the prescribed 10 minutes. Edit. People complaining of chest pains were typically brought back quickly, just not always within the 10-minute guideline, although generally faster than anyone else. This mostly seemed to be just about producing better stats, although keeping it off the system gave them the ability to delay. There are three kind of lies in the world: lies, damned lies, and statistics. My opinion, never trust an individual stat. They're almost always manipulated, and if you have chest pains, take aspirin. My mum's co-worker stitched his initials into a patient because he was so proud of his work. My best friend's mother, Rola, is from Lebanon. When Rola was a young girl, she got pretty badly injured and went to the hospital. The doctor then proceeded to tell Rola's mother that she had passed away due to the injuries. She did not believe her and soon discovered Rola locked in a closet, waiting to be presumably be sold into slavery. It was in the news here, but there was a surgeon in Birmingham, I think, who diathermed, essentially burnt, his initials onto patients' livers. My colleague worked with him and saw him do this. I personally haven't seen much. That's too bad. There are a lot of pretty dark jokes in the doctor's office, but nothing potentially damaging. A nurse did once offer to give me unprescribed flucloxacillin for a skin infection, but I politely refused. As a specialist who sees a lot of referrals, I see incompetence and laziness, which can be just as devastating, much more than outright unethical behavior. Literally less than half an hour before I read this question, my dad, a cardiologist himself, told me of a local cardiologist who tried to hire a hitman on his business rival, had a secret room behind a bookshelf that was filled with illegal weapons, and wrote patients' prescriptions so they could get their painkiller fix. Pretty weird that I read this thread right after he told me all this stuff. Link for the interested. Edit. More reputable source. It's gotta be this guy. He diluted cancer chemotherapy drugs for years to make profit. Countless deaths, countless needless treatments, countless cancer study data rendered useless by one man. A doctor prescribed chemo for patients who didn't actually have cancer. Not a doctor, but a male nurse at a hospital I worked at was caught sodomizing male patients as they were recovering from surgery. Docs in Pakistan do this. I heard from friend. 1. Do C-section surgery to create higher bill. 2. While fixing bone, steal a kidney to sell it off you don't even know. 3. Do tonsil surgery for no reason. 4. If getting late and some veins getting in the way of surgery, then cut it without knowing what is it, often resulting in death. 5. Doing surgery without anesthesia because drug is not available, hospital admin took money home instead of buying supplies. 6. Abducting newborn and saying died during birth. 7. Giving expired medicines. 8. Prescribing unneeded medicines because are given commission by international pharmaceutical companies. 9. Making patient visit 3 or 4 times by not treating fully. 10. Abandoning patient because 8-hour shift is over. 11. receiving salary in gov hospital and only show up couple of times in a year while bribing admin and run their own clinic. But 2k USD bill for 4-minute visit still is more outrageous to me here in Mick. In the hospital I work at there are many frequent flyer psychiatric patients. They usually have very serious social issues, for instance lack of housing, no money etc. Sometimes, when the psych unit gets tired of them, they buy them a bus ticket and send them somewhere far away so that they'll be someone else's problem. In the Seattle area the undisputed rulers of mass LASIK eye surgery were doctors King and Mokovac. King and Mokovac were on all the radio stations. They calmed DJs and talk hosts free LASIK in return for on-air testimonials. Everyone in the metro area knew doctors King and Mokovac. They were household words. Then it turned out that Dr. Mokovac tried to hire a Russian hitman to off Dr. King. The practice collapsed, and a lot of radio hosts had to explain their affection for a guy who was up for conspiracy to commit murder. Dr. Mokovac got 20 years in the canon. Dr. King is still in the LASIK game. More. This one diagnostician at Princeton Plainsboro has a crazy track record and takes tons of Vicodin every day. Yet somehow, he still has his own department. I went there for the clinic, and he revealed that I was cheating on my wife. I know a urologist who gave himself a vasectomy. My mom is a nurse that worked at a hospice. She was known among the other nurses as having a gift. When it was coming time for a patient to reach his or her end, my mom would be able to guess the time of death usually within 5 to 10 minutes. The nurses would make betting pools and really were fascinated by what my mom could do. They would tip her off on a patient in bad condition and she would go in and take their temperature, feel their feet, and check their pulse, and walk out with an exact time. She won a lot of money and free lunches in her stay there. When a higher management official approached her one day about it, she immediately started to apologize for her unprofessionalism. The manager stopped her and told her she was in fact impressed by her ability. I once had coffee in a no food or drink non-patient care area when JCAHO was around. I live on the edge like that. My doctor acquaintance bragged about making out with one of his patients immediately after she told him about being domestically abused. Not me, but my mom worked as a nurse in Brazil for a while and said that the doctors at her hospital would sleep during night shifts and it'd all be up to the nurses. They would get angry if they were awoken and wouldn't take the nurses seriously, which led to this one guy's death, despite my mom insisting that they check on him because he looked bad, because they didn't want to get up. Edit. By the way, this was in the 80s or so not sure if things have changed any by now. This will get buried, but this is a really disturbing chain of events that the hospital knew of and ignored. This doc molested multiple children, possibly 150, over 4 decades. My mom worked in a pediatrician's office as a receptionist. Their doctors had special codes for chart notes. Bob but ugly baby. They had more for things like noting the mom was an insufferable bitch. I don't remember specific abbreviations, but I can ask my mom later. I'm currently a medicine student in Mexico. One of my professors told us that during his residency he worked in hospital on a fairly poor area. In these sorts of places birth control is a relatively unused practice, leading to poor families of 6+ children. In effort to stop this, they began to sterilize women during their children's birth regardless of their wishes. It's still a fairly common practice in the hospital. I'm surprised there are no Dr. Harold Shipman responses yet. Admittedly, I've not read everything yet. The man wants so much unethical, but a prolific serial killer with 15 confirmed victims. But that number could be as high as 250 to 300 premature deaths caused by his care. Not by incompetence, but genuine premeditated murder. The only British doctor found guilty of murdering his patients, and the fact that he got away with it for so long genuinely worries me, especially as you trust a doctor and his treatment of you with your life. I know of a therapist who manipulated and groomed a 16-year-old patient for years to fall in love with him and obey him. After 25 years of being together and having kids, she ended up killing the guy. Stabbed him like over 20 times too. There was an old dentist in my hometown who was well liked. He was the sort of old timey dentist that wouldn't give you Novocaine or anything like that. For anything more complicated than a filling, he would pull the tooth. He preserved the teeth in his basement in a barrel of chemicals to keep it from smelling. He later put said teeth into a concrete memorial for his dog. Thousands and thousands of teeth. After he died, everyone learned he wasn't even a licensed dentist.